Welcome back. It is 9:16. According to Johns Hopkins University, just 5 states account for about 43% of new coronavirus cases over the last week. And they are New York, Michigan, Florida, Pennsylvania, and also New Jersey, just 5 states. And while cases have been rising, including here in Illinois, the good news is the number of daily COVID-19 deaths have actually been dropping. But the nation's top doctor, Anthony Fauci, says the number of new cases has plateaued at a disturbingly high level. Joining us to discuss is Dr. Shikha Jain with the University of Illinois at Chicago. Good morning, Dr. Jain. Good to see you on this Friday, as always.
Good morning, Sylvia.
Because of this surge in the metrics that are required for different phases of reopening in Illinois, what do you expect is going to happen next? Are we going to see some more shutdowns coming very soon?
So we talked earlier this month or last month about how spring break and these new variants were going to likely result in numbers going up, plus the loosening of restrictions. And so there is concern as our numbers continue to rise that we might start seeing some of the restrictions that we saw previously be re-implemented in order to control the surge that we are heading into and that we're in the middle of now. So I don't expect we'd see a complete lockdown, but I do expect we might see some rollbacks in some of the benefits that we've seen over the last several months with us doing so well at controlling this pandemic. Now that we're seeing numbers rise again, it would make sense that we start seeing some restrictions put in place again.
So you say rollback. So are you thinking it could be possible that indoor dining could be shut down again, or reduced capacity in general to different things besides dining, but businesses? What do you specifically see happening?
So I can imagine that there might be some rollbacks when it comes to capacity indoors, capacity for indoor dining, things like that, because we know those are risks for spreading COVID. With the weather improving, the hope is that more people will be able to eat outdoors and we'll still be able to support our local businesses and our local eateries. But I can imagine if our numbers don't get under control, that type of thing is going to need to happen in order to get our numbers back to where they're more manageable.
Okay, I was talking with someone from the Policy Lab yesterday. They predict COVID numbers, and he said the surge is partly to blame because of these new variants, as we all know, but also because people are starting to return back to normal, getting out more, gathering in groups, cutting back on mask wearing. Is this the case here? You've kind of alluded to that, but how much of a role is this playing?
Yeah, I think it definitely has a big part in what we're seeing now. It almost feels like we're doing a victory lap because we have these vaccines before we cross the finish line. And we know that these vaccines are very effective, but in order for them to be effective, we need to get them into the arms of people. We're at about a quarter of the population across the country vaccinated right now. The majority of the people who are vaccinated are those over 65. We are seeing that these new variants are spreading amongst younger people. A lot of people being hospitalized are in their 30s to 40s. So while there's a lot of hope and optimism, and these vaccines are really heading us towards the finish line of this pandemic, we can't be celebrating and dropping these mask mandates and socializing indoors and doing all those high-risk behaviors that we know result in spreading COVID. We need to get things under control. Otherwise, having the vaccine is going to be partially effective, but we're going to see people who are waiting to get their COVID vaccine getting COVID and admitted to the hospital while they're waiting for their opportunity to get a shot.
Let's talk about the shots right now. Vaccinations will soon be available to everyone. People have been experiencing side effects after a first or second doses. For those people about to be vaccinated with the first or second dose, what do you want them to know? Should they be planning a sick day the next day just in case of those side effects? Because they're happening.
So I'll tell you, some people have absolutely no side effects and some people have very significant side effects. So what I'm recommending to my patients is to talk to your boss and see if you can plan for either a sick day if that's possible or a lighter work day if that's possible. I think it's very individually based. If you're able to plan for a sick day, then that might be the best option, especially because we're not sure who's going to have these side effects. So if you're able to, after your shot, that would be ideal, but it's not absolutely necessary. Just have a conversation with your boss and the people you work with and see if it's possible to even have a modified or a lighter work schedule that day.
Okay, Dr. Shikha Jain with the University of Illinois at Chicago. Thank you so much. Great to see you as always. We'll see you next week.
See you next week.